All right. Hello, everybody. My name is Leah Kenya. I am a physical therapist at the Children's Therapy Center in our Falls Church location in Virginia, just in case you're watching from one of our other centers across the several states that we are located. And I'm very lucky to have Dr. Waba here with us today. We are just going to be discussing a little bit about, what we have seen since the pandemic has started, the changes that we're seeing in kids due to the pandemic, and just really the importance of checking in with your doctor regularly to make sure that they're meeting their milestones, that they're staying on top of their health, and that knowing that you have them there for support if you need it. So Dr. Waba, did you want to introduce yourself?
Hi, guys. Happy Friday. Just like Leah said, I'm Dr. Waba. I practice out of Vienna, part of Capital Area Pediatrics. We are located in different locations in the Northern Virginia area. So we definitely, I think this is a great conversation that we should be having, and we've been having with our parents for the past 2 years now about the importance of well visits, right? Well checkups.
Definitely. And Dr. Waba, what kinds of things are you seeing when your patients are coming in? What are the common frustrations or complaints that parents are coming to you for?
So definitely, I mean, this is not the past 2 years have been really, really very difficult for children. We've seen them struggle with so many things, and parents, of course, so families and children, but really as pediatricians, we've seen these kids struggle with social and behavioral issues. Definitely during the beginning of the pandemic, the illnesses were much less because these kids were not getting strep, they were not getting flu. So we were seeing less in sick visits appointments, but much more concerns from parents about social and behavioral issues. So grief, these children were going through grief. We've definitely seen some struggles with even development. And I think we're going to talk a little bit about that. So some of in the younger children as they were going through the pandemic. Absolutely overwhelming depression and anxiety that we've picked up, and other like eating disorders also was really, really high on the list of things that we've seen emerge even in very well-adjusted children, children who did really well at school. And then suddenly as we went through the pandemic, we've been seeing definitely a surgence back of these, not back, but like a higher percentage of it.
Yeah, and I would agree with you on that aspect. I'm a PT by trade, but with our OT and ST teams, we have really been seeing that the social emotional struggles are probably in the forefront of their concerns when the parents are coming to see us. A lot of our children may still would have had the delays that they had with or without a pandemic, but it's definitely heightened because of the sudden change in their life and everything that had to, the switch to relying on being at home all the time and not being able to participate in some of the things that might have been an outlet for them. So our therapists have definitely seen an uptick in just having those decreased opportunities for social interactions and not really sure how to deal with the change or having a good outlet for the change.
Absolutely. Self-isolation, social isolation. We've seen a lot of that in kids. All right. How about what are the concerns that our parents coming in with now versus 2 years ago that you've seen regarding development? Let's focus on development.
Yeah. So from the PT side, development-wise, we've seen more kids that are just having delays in their gross motor skills, especially those new crawlers or new walkers. And I think some of that has to do with change in lifestyle. So they haven't been leaving the house as frequently. Maybe they're not getting together and doing like those little baby and me classes. A lot of those weren't being offered in the height of the pandemic. I personally had a pandemic baby, so that was a different experience, you know, not being able to go out and about as easily as I wanted to, you know, with my first child. But a lot of these children just aren't getting as much opportunity. So where they might have started at daycare earlier on, maybe at the 3-month stage, then would have been exposed to other kids. They learn through observation. So when they don't get to see other kids crawling and walking and moving, there may not be as much internal motivation to do it right away. So a lot of times the kids that come to us with these slight delays in their gross motor milestones, they bounce back really quickly. Sometimes it's just figuring out strategies. Maybe it's just toy placement. Maybe it's to set up their environment in a certain way to really encourage them to move and explore and feel okay with exploring. And being in a new setting sometimes just helps with that as well too.
Absolutely. How about for speech? Have you seen also for speech, was there a little speech delay that you've seen?
A little bit. So, you know, I spoke to our speech therapist about this because I wanted to get their insight on what they've been seeing. And I know that the use of masks have always had families question, is that going to delay speech? And they really felt, I know there's some research that's popping up out right now, but they really do feel that the children that were going to have speech delays were probably going to have the speech delays no matter what. The masks don't necessarily add, you know, help to a certain degree, but those children were probably going to need that extra support at some point or another to really work on expression and word finding and all that kind of stuff. We also have found with just the change in the mode of delivery for education, switching to that virtual learning, the social isolation that you mentioned earlier, that some children are now stuttering a little bit more frequently. And that has been, we have definitely seen an uptick in that. And a lot of it is paired with the social emotional and that kind of social anxiety. So again, it's something that I think is very easier to address with the right help and the right, you know, supports.
Absolutely. Absolutely. So my other question for you is like, what are additional services or lines of support would most benefit like our patients? What do you think we need?
Sure. So when kids come to us and we might be assessing them for occupational therapy because maybe there's just some behavioral concerns and the family isn't sure what's the trigger, we're going to look and assess and see if it could be related to their sensory systems. When there's really no tie to the sensory system and it really seems like it's more purely behavioral, we can give some supports, ways to maybe modify their environment, maybe to anticipate what might be triggering some of the you know, difficulties that they're having. But when they're really showing some anxieties or maybe some depressive type of attitudes, we're going to refer them for mental health. I think it's so important for our kids to be able to access those services. Sometimes it might just be doing play therapy if they're young, where they're just playing and interacting with a mental health professional that can help kind of guide their feelings and their emotions. And in other cases, it might be more of that cognitive behavioral kind of therapy where they're, you know, having back and forth conversation, really working through some difficulties. Dr. Waba, what about you? What do you feel like you're doing support-wise for kids?
So definitely, I think in the beginning, we were in the beginning of the pandemic, parents were afraid to bring in the kids for the non-essential well visits, which is definitely not the way to go. During these non-essential visits, definitely essential issues absolutely come up. So remember, our well visits are not only for you know, time-sensitive immunizations and you know, and developmental screenings, but also developmental screening and mental health screening, which is very important too. It's a big part of your physical being, right? So during these visits, we definitely focus on every well visit depending on the age. We do mental health screening, whether it's by interviewing the young children or just watching their whole well-being. But as they grow older in teens, we definitely use like questionnaires out there, and we ask them certain directed questions to help us figure out if there's anything underlying. And remember, we also, during these well visits, not just detect serious mental illness or other issues, but we also detect serious childhood diseases, right? That, that we can, you wouldn't see the symptoms on the outside, so the parents will not be able to tell unless they come into our office. So definitely mental health has been high on our list, and especially during this time we've been focusing on that during our well visits.
And Dr. Waba, when you have a family that might be concerned about mental health, how would you encourage a family to bring up the conversation at a well visit? Maybe if they have a preteen and they don't want to have that conversation in front of their child, or they're worried about that stigma.
Yeah, so absolutely. So that's why we use pre-visit questionnaires, both for the parents, and we actually have ones for the children. So the preteens, we start at 8 years of age. And they fill out the forms. Now it's all electronic before the visit, but we do have the paper format in the office, and this kind of, when that gets pre-filled before the visit, kind of gives me shed some light on what I need to talk and what I need to address with the parents. Sometimes I even parents call me before the visit and say, hey, Dr. Waba, I didn't want to talk in front of my child, but this is going on and we'd like to address it. So it really depends on the family and the family dynamics. The way I deal with mental health is either we talk together. First, I can talk separately with the child and with the parent, and then we talk as a team to deal with whatever is going on. Definitely, they've been, I think in our area, we live in a very educated, highly motivated area. So I've seen a lot of parents come up, and a lot of children who come up and tell their parents, I need to see my doctor because I'm not feeling well or something, which is amazing because that's halfway through the diagnosis, right? When someone goes, but definitely working with the parent, we try to make sure that the child is comfortable and that the parent is comfortable with the conversation to move forward.
And then Dr. Waba, what would you say to kind of piggyback off of that? What are some warning signs that parents should look out for? Things that commonly they might come in that you might be seeing that would be a red flag for you?
So there's many red flags. So there's physical red flags that you can see. These children are either having sleep disturbances. These children are having problems with their appetite, with their weight, with their just mood in general. They become super angry or super, or have really, strong meltdowns, depending on the age, definitely. So there's physical stuff that the parents can definitely see. Sleep disturbances is one of the most, actually one that would usually show up early on, but weight and appetite and mood and just demeanor, right? And then school performance too, right? So you've seen these kids who've been like type A students, and then suddenly these children are not doing well, they're really struggling, so there must be something going on. And then emotional and other physical stuff, of course, we've seen self-harm and other things that might not be very apparent to the parent, and that's what we see during physical. I can't tell you how many times a parent had no idea that their child has been self-harming, because the kids these teens learn really well how to cover up and not be not show it to the parent. And that's where your pediatrician comes in, right? Because we do examine the body, we talk about that.
That's great. That's all great information. And I would say too, in the therapy world, a lot of times the children that might be coming to us are probably more in the, preteen, they're preteen or a little bit younger. And when they're seeking out services, it might be because of those behavioral outbursts that we're seeing them for. The other diagnosis that physical therapy will see a lot of children for is amplified pain syndrome. Mm-hmm. And that is a big one for our older children, where you kind of hit the nail on the head. They were type A personalities, really performing really well in school, and now they're having some, full body pain. There's stuff going on unrelated to anything physical. There's definitely more social emotional things occurring in their life, whether it be a change in routine, a change in school, change in friendships. And then they're dealing kind of with some multi-system issues. So like difficulty with GI issues, constant headaches, sleep disturbances, and it's manifesting as muscular pain. So we do see a lot of kids like that as well too. And we, immediately try to refer for mental health, but then also work on getting them exercising and moving again, so that they feel, they have an outlet, and then it also helps them kind of return back to their normal pace.
So that also includes, looking for these indicators or for these things that are going on with these children, seeking outside intervention or referral. And you guys can do the evaluation too, right? At Children's Therapy Center. Perfect.
Yeah. So we will evaluate a variety of diagnoses. If there's anything ever alarming or concerning, we're going to be contacting you. So we'll be reaching back out to the pediatrician to let them know. In some cases, we may even send the family back to the pediatrician for just, to have that check-in, to make sure that you have their eyes on them as well. So that we can always, kind of coordinate the care together and make the appropriate recommendation, by putting both of our minds together to see what's the best route for this child.
Absolutely, just to help that family out. Let's talk about what other types of programs do you wish were available for kids or parents that simply aren't out there now?
Sure. So right now with, the state of the pandemic, we still have to kind of maintain a little bit of that socially distant behavior, which is just tough. But a lot of our kids can still really benefit from those social groups. And those have had to take a little bit of a break. They're starting to come back a little bit. And I know that would be definitely a goal in our future to get back to hosting some of those social groups where kids have a safe place to interact and work on some of those communication skills that might be difficult for them. Maybe it's just play skills and interacting, and, making friendships and having conversations. So those social groups have been really beneficial in the past. And I think we had to put a pause on them when the pandemic hit. And, as we start to return back to whatever normal is now, it's finding what that happy medium is so that we can safely get our kids together to play. And, finding those groups out there where a child can be in a safe environment and they feel like they can, really open up and engage with other people.
Absolutely. What things do you think parents can do at home to make sure the child meets each milestone? What are the things? I know we talked about social groups and opening up a little bit, but what?
So for the new parent, I think that finding reliable resources is definitely helpful. Google can be a scary place, so we never recommend Googling. I'm sure you never recommend that as well. But there's some really reputable websites out there that focus on development. So pathways.org is a great one, and then 0to3.org are resources that are used in our early intervention communities. And they do some really nice charts. They have multilingual resources as well too, on what you should be looking for at each stage of development, from a communication aspect, from a development aspect, from the gross motor, social emotional, and fine motor aspect. So it gives you just some good, reliable information on what to look at. And then if you are looking at that and you're saying, my kid's not really matching up to what they're suggesting, then it's a perfect leeway to bring those concerns into your doctor to have that conversation. And for older kids, really trying to keep communication open between the adults who might see their children on a daily basis. So having an open line of communication with your teacher that is currently, seeing your child daily to see if there's any concerns that are going on. Maybe a coach that they're, trust. Or a neighbor. Maybe it's just someone that, they hang out at their neighbor's house a lot, and, you know, seeing if there's anything that they might notice or red flag or concern as well. And these are all ways that I think you can collect information and then bring those concerns to your well visit.
Absolutely. And that's also, you know, something that we work with parents with. And that's why sometimes it sounds like we're asking too many questions, but it's actually, we're trying to figure out if there's anything underlying, if there are triggers for what the child is going through, what are the things that we can work together as a team. When should a parent seek a referral or therapy if a milestone isn't met?
Yeah, and this is a common question we get, especially when they're already coming for us for one service. They might have some underlying other concerns. So maybe they're coming to us because they haven't started walking yet, but they also aren't talking. So a lot of times parents are like, well, what do we do? When do we go back and talk to our doctor about it? We always recommend having that conversation with your doctor if they start mentioning concerns about feeding or speech or fine motor. But really, it doesn't hurt to get the evaluation done. And then what we can do is help give you some supports and then maybe have you come check back in if we aren't seeing the gains. If it's not an area where we should be concerned yet, it's always a great way for us to kind of get a baseline and see where they're starting, give you some supports to try at home, and then come back and check in. And then we can see if there have been improvements, and if there has, great, then you're on the right track, and there's no need for continued services. Or if maybe we need a little extra support to help the child continue to grow and develop, we might pick up services at that point. What about you? When do you always recommend parents should bring concerns to the table with you?
So definitely, the way I think when I see a child and the parent has some is worried about some milestone delay or whether it's development, whether it's mental, whether it's behavioral, is that we try to find out if this happens only in the home. Does it happen at school too? So like with, inattention or hyperactivity, we try to figure out if it's happening in more than one environment. And if it is, then we definitely look into it by trying to figure out, I look into, like we said, the mental health, the behavioral issues, and then we decide together if it's time for us to refer. So if there's a developmental delay and we've been seeing it and it's something recurrent, I definitely refer out to PT, OT, and definitely speech also. And like you said, I work with the parents to see if the child is progressing or not. There are some children like we've seen kids with stuttering, which actually ends up being like an anxiety, like an underlying anxiety, right? So they go to speech therapy, they try their best, they're doing everything they can, but still the child has the issues are still going on. Then we look into it. Is there an underlying cause for it? So do we need to see a therapist, a psychologist? Do we need to see a psychiatrist? Do they just need to follow up with me and make sure that the child keeps, is doing well emotionally? So definitely looking at it as a whole picture and then referring out as needed.
Yeah, and I would, agree with you 100%. I think that, we always use the example of like peeling an onion back, that there's so many layers, and that what might be the outward concern is there's really something underneath that is the cause. And so it takes some time. Sometimes it takes some therapeutic intervention, and we might set the plan of care for a shorter period of time to see if we see gains right away. And if not, maybe we need to go a different route and kind of lead them in the right direction so that they can help get the support that they need to continue to make those gains.
Absolutely.
So Dr. Waba, what would you say when a parent's preparing for a well visit? What do you suggest that they do?
So definitely, if there's any concern, I love parents who come in with like a list of questions written down prehand, because sometimes, we do the physical exam and we do the well check. And then at the end of the visit, they're like, oh, now I remember there are 100 things. I love having, if you do have concerns, write them down. You can definitely communicate parents can definitely communicate with us. So we have a great electronic medical record where the patients can, where the parents can definitely send me messages before the appointment with any of the concerns. So I'll prepare myself and I know what to prepare for, but definitely having a list of questions, definitely talking, like you said, reaching out to like teachers. So if there are concerns about, attention, or there's concerns about hyperactivity, talking to the teachers before the appointment would be great, because that gives me more information that I can use, right, to help that family and help that child. So really doing their preparations, filling out the screens before they come into the visits is a great help, because then before I'm even in the room, I know exactly what I need to talk about. I can focus on that or highlight that one issue or struggle that that child is having. So really coming to well visits is super, super important. And I'm sure, just like I think we've talked about this before, about how, we're trying to keep everything safe in our offices, we're trying to keep the rooms clean. We're doing more telemedicine appointments, if the parents really cannot be there in person. So, definitely we on our side as a medical team are trying our best to keep your child safe while you're in our office. And also, I greatly appreciate, working with Children's Therapy Center, because you guys, honestly, I've been referring a lot recently. That's because what's been going on around us, but really having a good teamwork with people who are, center like the Children's Therapy Center, who respond back, work as a team with a family is a great thing.
Oh, we appreciate that.
Absolutely.
Yeah. And then one thing I did want to clarify. So when kids, preteens and teens, what's the difference between a well visit and then when they're doing something like they need a sports physical? Oh, sorry. I think you froze for a second. So I was just saying, when we have preteens and teens that are getting ready to play sports, now that sports are starting to come back a little bit more frequently, what's the difference between the well visit and the sports physical? And what do you commonly recommend families do when they need to get a sports physical?
So that's a great question. So there's actually a big difference between a well visit and a sports physical. A well visit is a visit that we look at, entire development, just like we said, milestones, vitals. We see how the child is doing. In a sports physical, it's a very concentrated. We concentrate on sports, just at the athlete's well-being. So we actually go through more of the cardiac history in the family. We look through, how the athlete or how the child has been doing in a sport, in the sports. Has there been injuries? We focus on previous injuries, preventing injuries. So we talk about like using gear and stuff to protect us. So it's really focused on the sports part of it. And definitely the exam is a little bit more focused on, the musculoskeletal system. But we also do a big family. We focus on like I said, cardiac family history of, sudden deaths and stuff. So it's really different than that. And we offer those definitely at Capital Area Pediatrics, and usually, depending on where the county you are, they need a sports physical forms. So we complete those forms and make sure that all the children are up to date on their immunizations for that too.
Awesome. Great. Well, it sounds like Capital Area Pediatrics has everything that our families would need to, chug along and make some great strides in their life. Any other questions for me, Dr. Waba?
I think we covered everything. I love this. I love that topic, and I hope that it was helpful for parents to feel a little at ease and feel motivated to actually keep bringing their children in for well visits.
Yeah. No, I definitely think that across the board, medical facilities have been doing an amazing job of keeping their their office is safe for families, and definitely, the sooner the better you can get in, just to make sure that your child is, making progress and continuing to grow and moving in the right direction.
Absolutely. Absolutely. Well, thank you so much for having me.
Yes, thanks for joining us. Any questions from anyone that might be watching today?
I'm not sure.
We don't have any audience questions, but someone wanted to make sure we knew that Dr. Waba is the best.
Oh, so thank you so much. I greatly
heard that from many people. So
that made my day. Thank you.
Well, thank you for joining us, everybody.
Yes, and this video will be posted to our Facebook page as soon as the live ends.
Perfect. Thank you so much.